So in the synovial joints, we have different types of movement, and we can classify those types of movement. So this is specifically related to the synovial joint, and it also has to do with muscles. So muscles are what contract, muscles only contract, to allow movement of one bone relative to another. So when we look at the muscles, we can sometimes say that a muscle has its origin, and this is on the bone that does not move. And then it has on its insertion on the bone that does move. Okay, so I'll put not there, I'll put a little, okay. So the insertion would be on the bone that does not move. So when we talk about movement, it has to occur at the joint, and muscles have to extend over a joint. And oftentimes they extend over a joint, or they do extend over a joint by tendons, because the tendon is the dense, regular connective tissue that attaches the muscles to the bones. So let's review that. The tendon is dense, meaning that it's got a lot of collagen, regular, meaning that they're all running in one direction instead of irregular, connective tissue that attaches muscle to bone. Okay. So when we look at movements, we can describe them in terms of their range of motion. So we can say that there is very little movement, and in fact, they might just glide, the muscle or the bones might just glide in relationship to one another. I think I mentioned that facet joints work like that. We talked about the facet joints in the vertebral column. So these are what are referred to as non-axial. So they do not move around, they don't have they're not moving in a plane relatively, they're just gliding on top of each other. So these are gliding joints. Oops, not gliding, gliding joints. Then we have uni axial. So this is moving in one plane. We have biaxial joints. So this is movement in two planes. And then we have what is referred to as multi-axial. And this is like movement in and around all three. So for example, my shoulder joint is an example of a multi-axial joint because it has so much range of movement. So this is a movement around all three planes. And there are diagrams that you have in your book that actually have a joint, and it tells you what the range of motion of that joint is. And so that would be an interesting thing to look at. We can also talk about the general types of movements. So general types of movement. We have gliding, which I mentioned up above. That would be sliding, slipping movements. We have angular movements. So maybe this would be the angular movement of my elbow joint because I'm changing the angle of the forearm relative to the upper arm when I'm doing flexion of the forearm at the elbow joint. And then we have rotational movements. A good example of that one would be like the dens of the axis rotating around in the atlas that allows me to rotate my head. And so those are types of movement, general types of movement. So there are some images that show this range, and you need to know examples of these. We have, as we move our hand side to side, that would be a gliding. That's gliding. Okay, those are actually just gliding. They're facets. They have flat articulating surfaces. These are synovial joints. Each one of these has a little joint capsule with synovial fluid in the wrist. We can talk about angular. So when we talk about angular, we can talk about flexion versus extension. And flexion is where you're decreasing the angle of the movement. So I'm decreasing it here at the elbow of my forearm. I'm increasing it, and then I have fully extended it. Now, if I go beyond 180, then that is hyperextension, and you don't want to hyperextend your elbow because that could damage the ligaments and the tendons, right? So flexion, extension, and then hyperextension. Now, when you're talking about flexion and extension, you want to talk about at what joint are we talking about? So when I talk about at the knee joint, flexion would be lifting my leg here, you can see here, that would be flexion, and then extending my leg. But at the hip joint, I'm actually lifting my whole thigh up towards my waist. And then, so if I'm saying I'm flexing my leg, are you flexing your leg at the knee, or are you flexing your leg at the hip? That's what I was trying to get around that. Extension of the arm to the back, right? That would be extending at the shoulder, this would be at the shoulder, not at the elbow, although we do have extension at the elbow. We could bend our elbow and have it in flexion and extend the shoulder back. Okay, so you need to tell me when you're describing these, it's really important to talk about what joint you are referring to. Rotation of the head. We have rotation of the thigh, for example. We could rotate it and turn our toes in, and that would be towards the midline. So that's medial rotation. We could turn the toes out, and that would be lateral rotation. So gliding, and then angular movements, and then rotational movements. Now, there are some names for movements that are very special and specific to a joint. And this is one of those. So notice here that both of these are called flexion. Dorsiflexion is where the top of your foot. Dorsiflexion is where the top of your foot comes closer to your shin so that you're flexing and you're like, what do they call that? Actually, when I say that, I say flex your foot, that's kind of what I'm meaning. Or when I say point your toes, I'm generally meaning plantar flexion. Plantar is the bottom of your foot. So plantar means the bottom of the foot. Dorsi means the top of the foot. And so that's the difference. So if I'm standing on my toes, I am doing plantar flexion. If I'm standing on my heels and lifting my toes, I'm doing dorsiflexion. And that is, these terms are specifically related to the ankle. The mandible, some other terms, we have protraction, where we stick it out and to retract. We can also do that with our scapula. We can protract our scapula, retract the scapula. I think if we like squeeze our shoulder blades together, that would be pulling them back. Those are sometimes used in other terms. Other terms that are not shown on here that I want to talk about is abduction, duction versus adduction. Okay, so to abduct is to like take away, right? So like I'm gonna abduct somebody, I wouldn't do that, but I would kidnap them, right? And then what that means is that you are moving your body part away. So like if I lift my arms out to my side, that is abduction. If I move my fingers apart, that is abduction of the fingers at the, what are these? These are the metacarpals. At the metacarpal and phalanges, I'm abducting them, right? And then adduction is when you bring things in. So if I squeeze my thighs together, I'm adducting my thighs at the hip joints. I'm squeezing them in, right? So add means to bring together. Abduct means to take apart. Okay, one more. This is the hand. So like with the foot, we have some special names with the hand. So if you are palm up, then you have supination. It is like you're holding a bowl of soup. So where is that? What is moving? Like I feel my wrists kind of moving, but maybe no. This is in your radio-ulnar joints. My elbow is staying in place. My wrists really aren't moving that much. I am rotating my radius and my ulna in relative to one another. And remember that those articulate distally as well as proximally. So that would be at the radio-ulnar joints, supination. And this is versus pronation. Pronation would be turning my palm down. So I can supinate and pronate my radio-ulnar, my forearm joints there. Okay, so that's an introduction to some of the movements that we'll be talking about.